Now to a respiratory virus emergency across the country as we head right into the holiday season. Hospitals are inundated with RSV patients. The Department of Health says that 78% of beds are already filled, and it's among children, premature babies, that are most at risk. We're learning all of this as hospitals are just bracing for this influx of flu cases as well. Let's bring in ABC News medical contributor Dr. Alok Patel. He's a physician at Stanford Children's Health. We've been talking about this for weeks now, Alok. So let's talk about the fact that we've got the flu, we've got RSV, and we've got COVID, all spreading across the country. Yeah, exactly. The big three, the trifecta. And look, we've all been hit from it. My family's been hit. Some have the flu. Some of this have this horrible cough. I've got friends and family members I've been talking to. My friend's mom had to be rushed to the hospital. I was just seeing right here, they couldn't figure out what was going on. She was getting dizzy spells. You know, could it be another virus that we just don't know anything about? I mean, what's your take?
Well, Kira, foremost, I hope your friend's mom is doing okay. And, you know, what's important about that story that you just shared with us is that hospitalizations among the elderly from RSV is also increased in comparison to previous years. So it's important for people out there to understand that we look at these three viruses, influenza, COVID-19, and RSV, and we often kind of narrow them down into specific risk groups and age factors, but they can affect people across the spectrum. And I think it's really important for people out there to realize that in the early stages of a cold, regardless of the cause, you don't need to sit and try to figure out what type of cold it is or what virus it is. The important thing for people out there is to know the signs that are concerning and when to seek medical care, such as dehydration, altered mental status, meaning someone feeling excessively sleepy or dizzy, or respiratory distress, which we've been talking about over and over again.
So the dizziness, then, explain that, because that apparently has been going around my kids' school as well. Is that tied to RSV?
You know, it could be a sequelae, like a long-term, I shouldn't say a long-term effect, but a secondary effect from one of these viruses. Because if you imagine, Kira, if somebody is extremely congested, such as little babies whom we see in the emergency department, it's very difficult for them to actually catch their breath and eat or drink. And dehydration can come up pretty insidiously in some of these vulnerable populations. And then all of a sudden, kids can appear dehydrated. And one of the first signs of dehydration in young children can be dizziness or seeming excessively sleepy. So we always tell parents out there, if your babies are still playing, wanting to run around, interact with each other, laugh, and things like that, you're probably okay. But the minute your kids seem off, if something just seems wrong and all of a sudden your kid seems disinterested in those normal everyday things that make children happy, check in with the healthcare provider.
So let me ask you about testing, because we can get a COVID test easily. You can go to the doctor and ask for a flu test. But actually, when I took my kids to the doctor, they said they couldn't do an RSV test there. We'd have to go to the hospital to do that. So what's the deal with that? Are you only able to go to hospitals, or does it depend on your doctor? Some can do it, some can't, because you definitely have to make it happen in some cases if you really want to see if it's RSV.
This is such an insightful question, Kira, and this is why you're a legend. So check this out. It's a little bit nuanced here. One of the things that can happen if you get tested for influenza and COVID-19 is you may be able to get an antiviral. Tamiflu for influenza, or with COVID-19, we have Paxlovid. There may be some changes in your management, but with the other cold viruses, such as RSV, you may not need to do anything differently at home. So in some cases, there is no need to rush out and find out which virus is causing your child's cold symptoms, whether it is RSV, rhinovirus, or a subtype of enterovirus. The supportive care at home is not going to change. And that's important for parents to understand out there, because you're not going to do anything differently if your kid has a cold, regardless of what the underlying cause is. Now, if your child starts to all of a sudden breathe really fast, or your child looks like he or she is using their chest muscles to move air, basically, if you look at your child and you're like, something here is not right, that's when you should check into your doctor and when we will run those tests.
Got it. Dr. Alok Patel, great to have you. Thank you so much.
Thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.